When one person has an issue, such as a mental health issue, that person often is very isolated to begin with. And then the immediate family is affected, the extended family sometimes is affected, and if the illness becomes quite severe, sometimes the whole community, and certainly our community, has been affected.
Sometimes people become more withdrawn. Sometimes people become more isolated. Sometimes their eating habits change. Their mood obviously changes.
Mental illness is really no different than any other physical illness that we know in the world. It just happens to affect the mind and the personality. So to me, I compare it no differently than any other type of illness.
Things like schizophrenia and the more chronic and persistent mental illnesses affect fewer people, and those that they affect are very profoundly affected. But in terms of society as a whole, mood, anxiety disorders, those are the kinds of things that I think are more common and more treatable.
Life for a person with mental illness varies. There is not one single thing that we can say other than it's tough. It's a tough life. And if a person has not ever had depression or anxiety, they don't have a clue as to how debilitating just those conditions can be.
Obviously the ultimate impact of a mental illness is suicide. It is a very tragic ending to something that is very treatable. For the first time in history in the past 20 years, we're seeing the suicide rate increase in teenagers. And I think we need to do what we can to reverse that trend.
Many adults look at kids and say, what could they have to be depressed about? They don't have to work, people buy their food, they live in a house, they don't have to pay rent. It's tough to grow up. And it's tough to learn how to develop the skills you need to be a competent, responsible adult.
We have a number of students who would surprise people on the outside if they were to know what they live with and how they live at home. We're so lucky to have the opportunity to work through Vera French and have a school-based therapist on hand. I can't imagine what we would do anymore without the Vera French assistance.
We are the community's resource for mental illness and mental health.
People think of Vera French as a safe haven. People think of Vera French as a place they can come if they're having a rough time. If they're decompensating, they can come here and not be judged and still be treated and helped and comforted. And my key phrase, and one that I grew up with and that I use a lot, is, it will be okay. So Vera French represents, to me, it will be okay.
I think when people don't get treatment, the downside to that is, obviously, number one, the quality of their lives is greatly diminished. I think in terms of the overall community, for communities to be successful, people have to feel like they're participating members of their community. When they're isolated, when they're not part of the community, when they're not connected to other people, we're not getting the full benefit of being a community that is operating at its best.
The community at large can be most helpful by saying, it's okay, we want to support you, we want to have you have help, because we know then that you're going to be a productive member of society.
Some people have the feeling Vera French is only for those with very, very severe mental health problems. But we also see people who are just having struggles, life struggles, and we still want to help those people function at an optimal level. In other words, our model is a health model, not an illness model. So what we promote at Vera French is health, mental health, and it's a great thing when people get better.
We help people to get back to functioning as normally as they can. It's very important for people to remember that most mental illnesses are treatable. So for example, with depression, 80% of people will respond to treatment and their life will be profoundly affected and profoundly changed in a positive way.
People can help by giving through the various ways that are available that we have. The other thing that they can do is be paying attention to the media and to the education process, so when we come across mental illness, we recognize it, we understand it, and we know how to deal with it.
Some people donate to Vera French because they knew Vera French and they loved her and they loved what she stood for in this community. Some people donate because they've had help here. Some people donate because they know we have helped other people. And that's our mission, and we welcome any support financially that we can get from the community. But I think the main way to help Vera French in this community is to help people feel comfortable in utilizing the services of Vera French, and anyone can be the one person to help us help others.